Some of the acute effects of cigarette smoking: it's a classic stimulant, meaning it increases your heart rate and blood pressure, alertness. It can suppress the appetite, and I hate to say this because I've had patients who told me that they wanted to start smoking cigarettes again because they wanted to lose weight. Carbon monoxide from smoking reduces that oxygen transport. Vasoconstriction means it constricts your blood vessels, which can result in increased blood pressure. It can also, ironically, in addition to having a stimulant effect, has a calming effect in some individuals. These are the acute effects, the ones that occur very quickly and very intensely. Short-term effects include, well, have a look. These tar-associated toxins can damage olfactory cells, the cells in your nose, your taste buds, and the tiny hairs or cilia in your throat. Adrenaline is released, the same adrenaline that we talked about when we looked at stress, and endorphins can be released. That's one of the things that produces the pleasurable feeling found in smoking cigarettes. Some report it feeling the same as a runner's high. Ironic that a smoker would report having a runner's high. Nicotine reaches the brain in 10 to 15 seconds. It has a stimulating as well as sedating effect, and it peaks within 10 minutes, stays in the body for up to 30 minutes, and then you need that nicotine again. Carbon monoxide can stay in your blood for 2 to 4 hours when you're awake, but up to 8 hours when you're sleeping. And again, carbon monoxide impairs the delivery of oxygen to your cells. The long-term effects, I'm not going to read these, but there are a lot of long-term effects. Health hazards include cancer, heart disease or cardiovascular disease, and stroke. But I want to talk to you about diabetes and tobacco. And this has to do with both conditions affecting the circulation of blood throughout the body. Smoking and diabetes both reduce the amount of oxygen that gets to your body tissues, resulting in poor circulation. Smoking can also raise blood sugars, making it harder to control diabetes. And for those diabetics who suffer from gangrene and wind up having amputations, studies suggest that up to 95% of them are smokers. If we look at the blood vessels in a normal foot as opposed to the ones on the right, the blood vessels have been damaged. Blood can't flow into the extremities or those tiny blood vessels, the blood capillaries, and when blood flow stops, tissues die. Nicotine is a blood vessel constrictor. It reduces the blood flow throughout the body. Smoking can increase cholesterol levels and harden the arteries. Diabetes increases cholesterol levels and levels of other fats in your blood. So between the smoking and the diabetes, the combined cardiovascular risk can be as high as 14 times those of either smoking or diabetes alone. Together, diabetes and tobacco use greatly increase the likelihood that you will develop heart and blood vessel disease. A tip from a former smoker and current diabetic: smoking makes diabetes much, much worse. Let's look at how cigarette smoking damages the lung. On the left, we have healthy alveoli, those grape-like sacs at the end of the bronchioles, and healthy lungs. On the right, we have damaged alveoli. One of the conditions associated with smoking is emphysema. This is a form of chronic obstructive pulmonary disease. What happens is that smoking paralyzes the tiny hairs that line your lungs, your air passages. So when those hairs are paralyzed and can't move, your lungs can't clean whatever it is that you are inhaling. You also have inflammation in the lungs, causing a loss of elasticity in those tiny alveoli, those air sacs, which then can't take in oxygen when you breathe. And the person with emphysema may spend up to 20% of their calories being used to help them breathe. On the right, you can see the difference between a microscopic view of normal alveoli and alveoli with emphysema. What goes in doesn't come out. So we have healthy lungs and healthy alveoli, But with smoking, particles from the smoke get trapped in those alveoli because the cilia that normally line the lungs and would get rid of these particles are themselves paralyzed, unable to work. So you inhale these particles, they get deep into your lungs and get trapped in your alveoli. Your immune system recognizes these as non-self and triggers an inflammatory response. The chemicals that are produced during this inflammation dissolve the alveoli, creating large cavities lined with carbon deposits, and that leads to emphysema. Before tobacco became popular, lung cancer was a relatively rare disease. It's suggested that smoking causes 80% of the deaths from lung cancer. It's linked to the two major types of lung cancer, small cell and non-cell carcinoma. Carcinoma means cancer. You don't need to know the two different kinds. Just know that smoking is linked to both.